So today we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Since the previous update at the end of July, the Delta-driven wave has continued to accelerate along the strong resurgence trajectory. This is a crucial moment. We have a window of opportunity to rapidly accelerate vaccine uptake and close the protection gap in younger age groups with the lowest vaccine coverage. As we head into the Labor Day weekend and return to more indoor activities this fall, Canadians, whether fully vaccinated or not, are urged to maintain layers of personal protection, including masking and spacing, to protect themselves and others while helping to dampen the impact of the growing Delta wave. Since the previous modeling update, average daily case counts have increased rapidly from just over 640 per day nationally to almost 3,500 per day. Severe and critical illness trends had been decreasing are once again on the rise. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has more than doubled since the last update to over 1,200 daily. Of these, on average, more than 440 were being treated in intensive care units, and there were an average of 13 deaths reported daily.
Diapositive 2.
Slide 2.
Du taux d'occupation des hôpitaux et des unités de soins intensifs, certaines provinces et territoires commencent à signaler
following weeks of declining hospitalization and ICU occupancy, some jurisdictions are beginning to report increases, but it is still too early to determine the extent to which vaccination may be reducing the severity profile of COVID-19. This is in part because severe outcomes, including hospitalizations, lag behind rising disease activity, so we can't yet tell what the severity would look like in the weeks ahead. There are still regional differences in disease activity levels, including some areas where the virus is surging and could result in a heavy impact on the healthcare system and significantly increase critical care admissions. In more heavily impacted areas, it is possible that more stringent measures may be needed to reduce spread if increases in severe illness threaten critical care capacity.
Slide 3. More than 53 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December, providing over 84% of the eligible population aged 12 years or older with at least one dose of COVID-19 vaccine, and 77% are fully vaccinated. Covering this last stretch to reach very high vaccinating coverage across all eligible age groups could prove crucial to reduce the impact of the Delta-driven wave. Rapidly increasing vaccine uptake, including for first doses, will require public health and communities to urgently accelerate targeted approaches that reduce barriers, provide support, and reach people where they are. Everything from mobile clinics and drop-in access to more locations, information, language and cultural outreach resources can make a difference to getting more of the population informed, confident, and protected. Nevertheless, where there are pockets of under-vaccinated people, there is an ongoing risk of rapid community spread, high numbers of hospitalization, and potential for emergence of new variants of concern.
Diapositive 4.
Slide 4. Although vaccine coverage has increased across the age groups, with 88 to 94% fully vaccinated coverage in those aged 60 years or older, the rate of vaccine uptake has slowed across the younger age groups. Although COVID-19 has generally been less severe in younger people, infection can still result in serious or prolonged illness in any age group. And recent evidence shows Delta variant infections cause more severe illness than previous variants. The ultimate goal is to get as many eligible people fully vaccinated as soon as possible to provide strong protection against symptomatic disease and severe illness. There are still over 7.6 million eligible Canadians that are not yet fully vaccinated. And this is why we must take this window of opportunity to rapidly increase vaccine coverage and protect everyone we can.
Slide 5. When you are vaccinated, you reduce your risk of serious illness, hospitalization, and death due to COVID-19. Remember, vaccines take time to work, and it typically takes about 2 weeks following the second dose for the immune system to build up protection. What is most encouraging is that vaccination is proving to be highly protective against severe illness. In recent weeks, from July the 18th to August the 14th, the average weekly rate of new cases in the unvaccinated was 12 times higher than in the fully vaccinated, while the rate of hospitalized cases was 36 times higher in unvaccinated compared to fully vaccinated. This aligns well with vaccine effectiveness studies that demonstrate strong protection against severe illness in vaccinated people. As well, based on close monitoring of the use of COVID-19 vaccines across Canada and worldwide, we know the vaccines are very safe and that vaccination remains our best protection against COVID-19, including the Delta variant.
Diapositive 6.
Slide 6. This updated longer-range forecast shows how the epidemic trajectory may evolve through mid-September. It suggests that our Delta-driven fourth wave will continue to accelerate. This updated model shows if we continue on the path we are on now since reopening, we could expect to see a continued sharp increase in cases along the dark gray line trajectory, reaching levels not seen before in Canada during the pandemic. We expect cases to be concentrated largely among unvaccinated people, and the higher volume of cases could ultimately lead to rising rates of severe illness and hospitalization. This is because, with current and projected levels of vaccination, there is still a large enough pool of unvaccinated people and a sufficiently high rate of contacts to permit widespread circulation of the virus. However, if we were to take steps to reduce the spread, for example, by consistent use of personal protective and public health measures, we could slow epidemic growth along the purple line trajectory. This forecast reaffirms the importance of remaining vigilant and responsive as cases continue to rise and highlights the need to take steps to reduce spread.
Slide 7. Updated complex modeling scenarios accounting for factors like increased number of contacts with easing of public health measures, vaccine uptake, and impacts of the Delta variant continue to show that we could experience a large resurgence this fall and winter. Unfortunately, with the earlier than expected reopening and the current slowed rate of vaccine uptake, Delta variant spread has accelerated quickly. The scenario on the left shows that there is a risk that hospital capacity could be exceeded by the Delta-driven resurgence. However, there is still a window of opportunity to reduce the rate of epidemic growth and get on a better trajectory. By increasing vaccine uptake among adults aged 18 to 39 years and speeding up the overall rate of vaccination, the scenario on the right shows that we could dampen the resurgence to significantly reduce the risk of overwhelming hospital capacity. Considering younger age groups continue to have the highest rates of infection and are the most mobile and socially active across a wide range of work, recreational, and educational environments, Increasing and accelerating vaccine uptake could have a substantial impact to reduce disease transmission, lower the number of people with severe illness requiring hospitalization. The bottom line is that millions of people across Canada remain unvaccinated and at high risk of COVID-19 infection and severe illness outcomes. There is still time to get vaccinated to protect yourself and others in your community while helping to preserve our healthcare capacity through the fall and winter.
Diapositive 8.
Slide 8. Canada has made significant progress increasing vaccine coverage. But as we head indoors this fall, the latest modeling shows the urgent need to get more 18 to 39-year-olds vaccinated and speed up the overall rate of vaccination. With more than 53 million vaccines given across Canada and more than 25 million Canadians fully vaccinated, evidence continues to show that COVID-19 vaccines are safe and effective in reducing serious illness, including hospitalization due to COVID-19. Getting more eligible people vaccinated faster could have a significant impact to slow the rapidly spreading and more severe Delta-driven resurgence, to protect healthcare capacity and reduce societal disruption. 12.5 million Canadians need better protection, including those who are not yet vaccinated, those who still need their second dose, and children too young to be vaccinated. For parents of young children not yet eligible for vaccination, getting yourself vaccinated and encouraging others who are eligible is the best way to protect them and get them back to school and the things they love. Regardless of our vaccination status, an indoor fall and winter also means maintaining layers of protection, including masking and spacing, and taking precautions like staying home if you develop any symptoms. Thank you.
So slide 8. Canada has made significant progress in increasing vaccine coverage, but as we head indoors this fall, the latest modeling shows the urgent need to get more 18 to 39-year-olds vaccinated and speed up the overall rate of vaccination. With more than 53 million vaccines given across Canada and more than 25 million Canadians fully vaccinated, evidence continues to show that COVID-19 vaccines are safe and effective in reducing serious illness, including hospitalizations due to COVID-19. So getting more eligible people vaccinated faster could have a significant impact to slow the rapidly spreading and more severe Delta-driven resurgence, to protect healthcare capacity and reduce societal disruption. 12.5 million Canadians need better protection, including those who are not yet vaccinated, those who still need their second dose, and children too young to be vaccinated. For parents of young children not yet eligible for vaccination, getting yourself vaccinated and encouraging others who are eligible is the best way to protect them and get them back to school and the things they love. Regardless of our vaccination status, an indoor fall and winter also means maintaining layers of protection, including masking and spacing, and taking precautions like staying at home if you develop any symptoms. So thank you. Merci, Megwidge.